Good afternoon, everyone. Thank you so much for being here. We don't quite have quorum yet, so we're just going to give it another minute or two. We'll be back here in just a moment. Elizabeth, are you here on behalf of Karen Bishop?
Yes.
Ah, okay. I misunderstood that you were here on behalf of Peoria.
Oh, no, I am so sorry. I didn't hear that. It's with Chandler.
Got it. Hi, Ileana. Thank you for joining us.
Hello.
Appreciate it. All right, Madam Chair, we are one shy of quorum. We're getting there. Ileana, is there any chance that you are related to Eric?
Yes, he's my husband.
I wondered if he was your husband. That's so funny because your last name is not that common, and I interact with him every so often.
Yeah, I'm like, oh, are you gonna take lunch? He's like, no, I have a MAG meeting. I'm like, oh, nice. He's there all the time.
With Frank. Yeah. Okay, Madam Chair, we have confirmation of one more on their way. They were just looking for the Zoom link, and you will have quorum, so we'll give it just a second. I'm sorry. I know meetings this time of year are particularly difficult to rally. People are out and about doing other things, so we appreciate everybody who's here today. Susan, okay, great.
Awesome.
Madam Chair. Hi, Susan, welcome. You do have quorum.
Thank you. Well, good afternoon, members of the MAG Human Services Technical Committee. This meeting is now called to order. It is being recorded and live streamed on YouTube as a way for members of the public to participate. So please state your name when making a comment or asking a question. I will ask that you keep your microphones on mute when you are not speaking. We will now begin the meeting with a roll call of all members.
Thank you, Madam Chair. Elizabeth Garcia on behalf of Karen Bishop.
Present.
Thank you. Seth Dyson. Autumn Grooms. Kathy Chang on behalf of Jacqueline Edwards. Jerry Guajardo. Ileana Godinho.
Present.
Thank you. Susan Hallett.
Present.
Thank you. Mary Lynn Kasanick.
I'm here. Present.
Thank you. Thank you. Phil Yabes on behalf of Rachel Sanders.
I'm here.
Thank you, Phil. Kristen Charlow. Vice Chair Melanie Dykstra.
Here.
Thank you. Chair Christina Panatescu.
Present.
Thank you. Madam Chair, you have quorum.
Great. Thank you, everyone. Our next item is a call to the audience. This is an opportunity for the public to comment on items that fall under MAG's jurisdiction that are not on the agenda or that are on the agenda for discussion and not action. Members of the public could submit written comments via the MAG website 2 hours prior to the meeting. Staff, do we have any written comments for this item?
Madam Chair, we do not have any written comments for this item or any other items on your agenda today. Thank you.
Thank you. Our next item is the approval of the October 12, 2023 meeting minutes. Does any member of the committee have any questions about the minutes? Hearing none, is there a motion to approve the minutes?
Melanie with Gilbert will make a motion to approve.
We have a motion from Melanie. Is there a second?
I second. Elizabeth Garcia.
Thank you. We have a motion and a second. We will now have members take part in the voice vote by turning on their cameras and unmuting their audio. For those who cannot or do not want to turn on their cameras, we will conduct a roll call vote. Members, please leave your cameras on until after the roll call vote. Can I have a voice vote from members? Those in favor, say aye.
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 Those opposed, say nay. Staff, can you take a roll call vote of any members who did not participate in the voice vote?
Pardon me, the only two I didn't hear, Madam Chair, were Elizabeth Garcia and Phil Yaves. If you could just let us know if you approved the minutes, we'd appreciate it.
Yeah,
Aye.
I said aye.
Thank you. Madam Chair, the minutes pass.
Great. Thank you so much, everyone. The MAG Human Services Technical Committee develops an annual allocation recommendation for the Social Services Block Grant on behalf of the Arizona Department of Economic Security. It is really the impetus of our group, where we are rooted and come from. The recommendations are based upon the prioritization of human service related needs in the areas of, I just lost my my guide, sorry, 1 second. In the areas of adults, families, and children, developmental disabilities, older adults, and people with disabilities. Kelly will present the fiscal year 25 SSBG recommendations for HSTC approval.
Thank you, Madam Chair and members of the Human Services Technical Committee. As a reminder, we are presenting you today some decisions that a work group of several of you participated in have come up with. I'll walk you through all of these. We're asking you today for your recommendation of this to move forward to the Human Services Community Initiatives Committee, which will meet in January. They will then vote upon it and it will go back to DES, ideally with your approval. So let's move on to the next slide, please. So just to give you a very basic overview, the Social Services Block Grant, these are federal dollars that come to Arizona to the Department of Economic Security. The Department of Economic Security looks to organizations like MAG around the state to help make decisions at a more local level, to help provide funding to aid in individuals who need additional support to be self-sufficient and to thrive in our communities. This may include children and adults who are experiencing neglect, abuse, etc. And we have done this annually for many years at this committee, at the Human Services Technical Committee. Next slide, please. The funding amount for Maricopa County remained flat from last fiscal year's decision, which was a little over $3.6 million, to this year's fiscal year. The fiscal year is the federal calendar year, so it begins July 1st. We are technically making financial decisions for fiscal year 2025. This work funds the Department of Child Safety Case Management, Supportive Intervention, and Crisis Shelter Services. Next slide, please. In addition to the Division of Aging and Adult Services and Rehabilitation Services Administration. Again, specifically, if you're thinking about the funding goes to both children and adults who need additional support to be successful in their current environment. Sometimes that's food delivery, sometimes it's counseling. There is a category for teens who are pregnant and may need some additional supportive services. Next slide, please. One of the consistent asks of your committee is that MAG staff do a more concerted effort to meet with officials at the Department of Economic Security who are in charge of these funds to better understand how the funds were spent in the previous fiscal year. We have heard this ask. We have made multiple attempts at trying to schedule quarterly meetings with DES leadership who oversee these funds to better understand how the funds are distributed and how the funds are being used. While we have had improved communication, we did not have greatly improved understanding going into this decision-making work group on how the fiscal, on how and why some of the funds were not used. We'll go into that in the next slide, please. So what we learned was that the one category that did not have a full spend down was in this area where there was $2,000 left toward extended supported employment. Excuse me, this $2,000 left in supported extended, you can see there. So adaptive aids and devices was allocated last year, about $2,000. None of that funding was spent. Rehabilitation instructional services was funded over $2,600. None of those funds were spent. And of the extended supported employment, there was a little over $2,500 that was left at the end of the contract year. Why those funds were not spent down is not clear. What you will hear me say over and over again is we are going to continue to try to work with DES to better understand why these categories are not all at a zero if the money is being sent out appropriately to community providers. But with this in mind, your work group decided to make some funding shifts for fiscal year 2025. Next slide, please. So again, just to give you some background, all contracted amount to local areas in Maricopa County were fully spent down in the other two areas. So in RSA and the Division of Aging Adults, the funding was entirely spent. It was only in those three areas in the previous slide where there was some remaining dollars from last year's decision that weren't completely spent. Next slide, please. Your work group came together and they decided that taking the information they had in hand to make their decisions, they wanted to keep the funding for the Department of Child Safety the same from 2024 to 2025. Same for adult services. And the RSA funding, they did adjust slightly. They took that section of adaptive aids and devices, which had about $2,000 left in it, and they decided not to fund that, but instead to take that money and the money that was from supported employment and shift those dollars into rehabilitation instruction services, with the idea that hopefully, because that's a larger category of funding, more of that money will be able to be spent down. Next slide, please. Your Human Services Technical Committee work group this year consisted of Chair Panatescu, Susan Hallett with City of Phoenix, and Mary Lynn Kasinek with the Area Agency on Aging. Next slide, please. And I'm open to any questions you may have. You were sent the Excel document in your packet for this meeting that shows you a little bit more about the details. Ultimately, the group of looked at $3.6 million worth of funding and decided to change about $7,000 of where that funding was going to be allocated. I'm available to any questions you may have, Madam Chair, and members of the committee.
Thank you. Great job, Kelly, providing the context and helping us all get clear on the background and the process that we did. And I do want to thank Mary Lynn and Susan for your work on the committee. Melanie, you have a question?
I do. I'm just curious, out of that category that you move the money to, is there any opportunity for people to get support, like if out of that category or whoever's managing that, if someone needed an adaptive aid or device or employment, is it eligible within that category, do we think?
Madam Vice Chair, I am not aware if that is eligible. What we suspect happened is that because the funding in the adaptive aids was so low that even if they needed to access it, it wasn't enough money to cover the cost of something they wanted to be able to purchase.
Which is not surprising. I was just curious if by getting it into a bigger pot, whether or not it's still an eligible expense out of their pot so that it would be something, but I definitely understand that definitely not being enough to try to deal with those two. So I do support the move.
Thank you. Any other questions or comments?
Okay, sorry, one more question, and then I'll actually leave my hand. So you found out that all the other two categories, they did do full expenditures in all of their previous allocations.
That is correct, Madam Vice Chair.
Okay, thank you.
So of the $3.6 million for fiscal year 2024, last year's fiscal year, only $7,000 was not spent.
Okay.
And we didn't want to take that away from the category because they didn't spend it. We wanted to give them an opportunity to spend it if it was in the bigger pot that they did exhaust, because they exhausted the pot that it was put into, as I understand it, right, Kelly? Yeah. Any other questions or comments or a motion to approve the fiscal year 25 social services block grant funding allocations?
Melanie from Gilbert make a motion to approve the funding allocation grant SSBG.
Thank you. Is there a second?
Technically, Madam Chair, you need a recommendation. We need a motion to recommend.
Oh, a motion to recommend.
I will amend mine to a motion to recommend that's right, because the next group will do it.
Yes.
And I'll second it.
Thank you, Susan. So we have a motion from Melanie and a second from Susan to recommend the FY25 Social Services Block Grant funding allocation. We will now have members take part in a voice vote by turning on their cameras and unmuting their audio. For those who cannot or do not want to turn on their cameras, we will conduct a roll call vote. Members, please leave your cameras on until after the roll call vote. Can I have a voice vote from the members? Those in favor, say aye.
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 And those opposed, say nay. And then staff, is there a reason for a roll call vote?
Madam Chair, the only person I didn't see was Mary Lynn Kasanik. Mary Lynn, do we have you're on here twice. Never mind. You're on here twice. That's what was confusing to me. No, Madam Chair, the motion passes. Thank you.
Okay, great. So now moving on to agenda item 5. In partnership with Access 211 Arizona and Solari Crisis and Human Services, Contexture implemented a single statewide referral system, Community Cares, to address social determinants of health needs in Arizona. Kelly McGann, Contexture's Social Determinants of Health Director, will provide an overview of the referral system and discuss ways that members of the committee may participate in the work.
Thank you. Hi, everyone. Thank you for this opportunity. Do you all have slides to share, or should I pull up the slides myself? Oh, perfect. Great. Thank you so much. As mentioned, I'm Kelly McGann. I am the SDOH director at Contexture. So I oversee our Community Cares program in Arizona, as well as Contexture's Colorado SDOH programming as well. So next slide, please. And again. So today I'm going to go through an overview of the Community Cares program. We'll then discuss the program goals and benefits. I'll highlight some of the network standards and expectations of participants, and then we will look at how the Community Cares program works to address social determinants of health for Arizonans. Next slide. Perfect. Sorry, one back. Thank you. So I wanted to just start super high level by sharing what Community Cares is, and then I will move forward and talk about the different partnerships and how we all participate within the program. But for those of you that aren't familiar, Community Cares is Arizona's statewide closed loop referral system. And so we partner with a technology vendor, Unite Us, which I will talk more about in a bit, to offer this solution statewide. It is a free solution for organizations to screen for and electronically send referrals for their patients or their clients that they are working for, or with focusing on the social determinants of health. Next slide, please. So Community Cares was developed out of Access's Whole Person Care Initiative, which began in 2019, with the goal of really focusing on social risk factors and exploring possible solutions on how to effectively screen for and then send referrals for the social determinants of health across the state. Really trying to bring together sectors, so healthcare and community-based organizations, sending and receiving of electronic referrals. Next slide, please. So as I mentioned, there are a lot of partners involved in the statewide initiative. And really it is a true partnership. We couldn't do it without any of the partners here. So Contexture, we work closely with Access to offer and have oversight of implementation of the closed loop referral system across the state. Access is funding this initiative, as well as we do have some philanthropy partners as well. And Access offers this as a free solution for across the state. And so it is not just a system for Access providers, but really for all of our healthcare providers, government entities, and community-based organizations. As I mentioned, Unitas is the vendor. So that is the software solution that we utilize to implement the Community Cares platform. And then Solari partners in a variety of ways. One of them is we have successfully ingested the full Solari 211 resource directory into the platform. And so what that means is all of the resources that are within the resource directory are available and searchable within the system. Solari is also involved in partnering on our community engagement efforts. And so we have a lot of connection and partnership with them, and they're super involved in the program as well. Next slide, please. So I already talked to this, but just didn't want to gloss over the importance and the partnership that we have with Unitas. We work hand in hand with them to onboard our partners across the state. And we provide individual onboarding support. And so what that means is for an organization who is interested in participating in the Community Cares program, we will sit down and really understand what are the workflows, how do you currently send referrals, how can we best support you in implementing a new system into your current workflows and your day-to-day activities. And then we will provide training based off of each organization's needs. Next slide. And then just wanted to call out Contexture's role. So as I mentioned, we implement and have oversight of the program and really convene all of the stakeholders. We engage our participants in an effort of really providing as much information to providers so that they can therefore, make better decisions for their patients, ultimately with the goal of better health outcomes. Contexture is also known as the Health Information Exchange for Arizona, as well as Colorado. On top of that, we have the Arizona Healthcare Directives Registry program, and then we do quality payment programs as well. Next slide, please. All right, so we can go ahead and jump into the goals and the benefits of the Community Cares program. Next slide. Perfect. So I mentioned earlier that Unitas and the Community Cares program is really a cross-sector solution. And the goal of that is to connect Arizona communities and providers so that information can more seamlessly flow between sectors. So we're not just focusing on our healthcare providers, but also our government entities, education, churches, and other institutions, as well as our community-based organizations, to help streamline the flow of information to better connect patients and clients to their social care resources that they need. Again, our focus is to provide access to information to improve health outcomes. We utilize a data-driven approach to really focus and target our outreach efforts to identify gaps in community resources, but also to help communities have access to information so that they can then make the best decisions for their communities and utilize the data to help inform their community health plans. We also partner with Access on the DAP program, which is the Differential Adjusted Payment Program, and I will dive into that in more detail in a little bit. But one of our goals is to support the SDOH DAP providers in meeting their milestones. Next slide, please. So some of the benefits of the program, as I mentioned, the system really allows for a more streamlined referral process of sharing, referral information from the sending organization to the receiving organization. But then it also provides an update on the outcome of that service. And so that is what closes the loop on the referral, when an organization can receive that update that the client they referred for maybe a food box was able to access that resource. They will then be able to see that the client had that need met. As I mentioned, it's a cross-sector platform, and so really the goal is to connect healthcare and community service providers, as well as our government entities. There is the resource directory, and so that is a fully searchable and up-to-date resource directory. So if there is not a resource that in your area that is live on the platform, while we would love to know about that so we can better do outreach to that organization, you can also research all of the resources through the directory and then send that resource directly to your client through the platform, either via text or email, or you could print out the resource as well. Focusing on our goal of utilizing a data-driven approach, we do have data tracking and analytics available through the system, as well as those outcome measures that I had mentioned. So as a participant in the platform, you will have access to the raw data for your organization, and you can pull that as an export directly from the Community Cares platform. But you will also have access to a Tableau dashboard, which lets you look into the network-wide data. This is aggregate, de-identified data, but you can really dive into the trends across the state of, what are some of the top requested service types, or maybe the top needs that are going unmet, and you can filter that, based on community and zip code, as I mentioned earlier, to maybe help inform some of your community health plans and efforts. Next slide, please. So through the Community Cares platform, there are a couple of different incentives that are available to participate in the program. So we have our community-based CBO success programs. The first program is an incentive program, which provides up to, it's actually as of earlier this week, I'm excited to announce that the milestone payments have increased up to $12,000 from $10,000, which is what you're seeing on the screen here. And this is really an incentive to help support CBO partners in implementing and utilizing the program and opting in to receive referrals on the platform. We know that it takes work. It is a workflow change management, but also it takes person power to manage and receive referrals. And so Access was able to provide some incentive dollars to help support our CBO partners. So that is the incentive program for our CBO folks. There is also the assistance reimbursement program, which offers up to $5,000 of support funds for reimbursement for technology purchases. So we know that, maybe for a food pantry to implement the Community Cares platform, they might have to purchase a computer in order to be able to access the platform. And so our CBO partners can, again, request up to $5,000 for technology reimbursement, but also they can request some reimbursement for staff time, again, knowing that it takes staff time to train and learn how to implement the system. Next slide, please. So as I mentioned earlier, one of the goals of the program is to support the SDOH DAP participants in meeting their milestones. So the DAP program is also called the Differential Adjusted Payment Program. And there are a couple of different programs within DAP. So one of them, there's the HIE program that has certain milestones set to it. But what Community Cares does is focuses on the social determinants of health milestones within the DAP program. And this really supports providers who choose to participate for screening their patients to identify their social care needs and then to send referrals utilizing the system. They receive a positive adjustment to their reimbursement from claims directly with Access. So just wanted to call that out so you all are aware of the different incentives that are available within Community Cares. Next slide, please. On this slide, I know it's a little bit lengthy and wordy, but I just wanted to call out who is available and eligible to participate within Community Cares. As I mentioned earlier, this program is funded through Access, but you do not have to be an Access provider to participate. So here you can see all of the different types of folks who can participate, but certainly want to call attention to our public health authorities, state and local government agencies, public and private schools, churches, and of course, community-based organizations are all eligible to participate in Community Cares free of charge. So access to the platform, access to the data analytics and reports that I had mentioned earlier is all free and covered through Access to really, again, foster the cross-sector collaboration, connection of services, really focusing on that whole person care and identification of social risk factors for Arizonans. On the right-hand side here, you can see, okay, so when we say free of charge, what exactly do we mean? So again, organizations will have access to the platform to screen for social care needs for their clients or their patients, and then also to send electronic referrals through the system. You will also have access to the data components that I had mentioned. And then on top of that, there are, of course, additional products that someone could choose to implement. An example of that is, for our healthcare organizations, if they wanted to pursue a technical integration with their electronic health record, that would come at a cost. But otherwise, access to the platform, the web-based platform, is free of charge. Next slide, please. All right, and again, next slide. So I wanted to spend a little bit of time just highlighting, so, when we're talking about participation, what do we mean? What are the expectations? So there are some network standards that we have adopted across the state, and that is really to ensure that if someone is participating in the platform, they are, going to be responsive to the referrals that they receive as an organization. And so here you can see to respond to a referral, the community standard is that an organization would respond within 2 business days. And then that organization would make 3 attempts to contact the client over at least 10 business days before closing out that referral. We also want to ensure that the information that is listed within the platform is accurate and up to date. And so we ask that organizations review and update their organization information, their program information, including if there's any eligibility criteria. We want to ensure that that is, again, accurate. And so we ask that that is updated once per quarter. And then we also ask that organizations, manage the users within their organization. So if someone leaves your organization, you will then have the ability to turn off their access to the platform. And again, this is all so that we can ensure that the network is effective and responsive to sending and receiving of referrals. I do want to call out here that organizations do have the ability to control how they want to participate within the platform. So what I mean by that is if you sign up to participate, you can choose whether you want to just be able to send referrals for your patients or your clients, or maybe you want to send as well as receive referrals. But you also have the ability to turn off that functionality. So if you signed up to receive referrals and then maybe your program is at capacity or you ran out of funding for a specific program, you have the ability to control if you want to continue to receive referrals. And so you can toggle to your settings and adjust how you participate within the program. Next slide, please. All right, and so I wanted to pull up some of the data that we're seeing just to show you over the last year how the program has been able to address social determinants of health for Arizonans. Next slide, please. So again, our focus is to connect, streamline the connection to resources, really focusing on that whole person care. I mentioned we utilize a data-driven approach. And so some of that is, again, to inform our outreach efforts to identify, okay, we're seeing that in this community, we don't have enough food pantries onboarded. And so we can target how we onboard and outreach based off of the data that we're seeing within the network. But also it is available for communities to utilize, again, to inform their community health efforts. And to identify ways to better support vulnerable populations. Next slide, please. So over the last year, this is some of the data that we have seen, and it's really exciting. So I pulled this, I believe, at the end of last week, so it's pretty up to date. So currently we have over 948 organizations live on the platform. And so what that means is they are participating in some way, whether they are sending or receiving referrals within the platform. You'll see the little asterisk there, that is at the site level. And so let's say, organization A has 2 locations, that would count as 2 organizations. So I just wanted to call that out there. Of those 900 organizations, there are over 2,000 programs that are live on the platform. I mentioned the resource directory. Because of the resource directory, you have access to over 3,500 resources. And we have seen more than 7,000 referrals already be sent across the Community Cares platform. So we're super excited to see this utilization from the participating organizations. Next slide, please. So here you can see the trend of onboarding. So really from the beginning of the year, we have seen an increase in our onboarding, and at the bottom, all of the different colors highlights all of the different types of participants. And so you can see in the purple, if you're looking closer to the left-hand side of this graph, that is our CBO partners. And we are really, really excited to see that bar has grown over time, because we know that in order to have an effective and robust network of resources, we really need to engage our CBO folks. And so it's really exciting to see that improvement. Next slide, please. As we've seen the number of partners onboarding grow, we've also seen an increase in referrals by month. So this is just, again, a really exciting trend that we expect to continue to grow. Next slide. And then, as I mentioned, I just wanted to show you some of the network data that we are seeing. And so you're looking at historical data. This is all of the referrals that have been sent by the service type. So the service type is listed out on the left-hand side. And then the different colors references whether those referrals were declined, managed, were they off-platform referrals, meaning, those Solari resource directories. They could be recalled referrals, or are they still in that referred status? And so what I would love to call out here, of course, this is probably not surprising to you all, but the top 2 requested resources are housing and food assistance. And then the blue bar that you're seeing in each of those lines is the number of referrals that were managed, which means that they were accepted. So it is really great to see that, if we're looking at food assistance, the light blue is all of those referrals for food assistance that have been accepted. Next slide, please. All right. So today I just wanted to provide a high-level overview, but we would love to have you all come to one of our upcoming community information sessions where you can see a demo of the Community Cares platform and see all of the benefits and everything that I mentioned, all of the action in real life. We would love for you to join the Community Cares Network and really would love to brainstorm on how we can best make this program effective for you, whether that is you want to participate to send referrals for your patients, or you would like to receive referrals, or even if you would like to participate to be able to access the resources. We would also love to support your partners. So as you're onboarding, we will ask you who are the important partners that you would like to be onboarded as well. And we will work to outreach and engage your partner organizations. So I've included the Community Cares email inbox, and I'm happy to put my email inbox in the chat as well. The community information session link is actually a live, it's a link that you can look at all of the upcoming information sessions. And we would, excuse me, we would also be happy to come do an information session for your group, for any coalitions that you participate in, or for your organization, either in person or virtually. And that is everything that I had for today.
Thank you, Kelly. Are there any questions for Kelly?
Madam Chair,
Go ahead.
Melanie, Susan, and Seth have their hands up.
Okay, we'll start with Seth.
Snap, I wasn't ready. All right. Thank you, Chair. Just a quick question. Are any local municipalities using this platform already?
I'm really excited. So you could imagine with some municipalities that contracting can take a little bit of time. But I'm really excited to say that Maricopa County, we were just able to execute an agreement with them. And so we have, I think, an information session coming up maybe next week, and then City of Phoenix as well. And then I see you're in City of Surprise. We are really connected with the fire department and Chief Rivera. We've talked with him quite a bit about the platform.
Kelly, before we go on to the next person, do you know if there's cooperative language in the county or City of Phoenix contracts?
That sounds very legally to me. And so can you expand on that?
If there's certain language in the contracts, other cities and municipalities can piggyback onto the contract without having to go through like a procurement or their own in-house contracting process, so it can expedite things. So if it's not in there, you may want to get it in there so that everyone who follows goes faster than what you're experiencing now. Maybe Susan knows if Phoenix has it.
So, I believe that Kelly, correct me if I'm wrong, that you've been talking with our business and workforce development division. Is that right?
Let me pull it up. I believe so.
Okay.
Yes.
And so which is part of our actual department, the Human Services Department, but it's not within my division. And so I have not seen the language, but I would agree with Chair that, that cooperative language is probably a smart thing to do.
Perfect. I don't know the answer to that, but I will circle back.
Okay, great. Thank you. And then I know Melanie, or who else? Susan, were you one of the people with your hand up?
Yeah,
Oh,
I did.
keep going.
and so my comments are a little bit broader. So I've been in human services for over 30 years, and I've been through a number of these experiences where there's this effort to do this collaborative, collective data poll and retention, and to make it worthwhile and to make it valuable. And the irony of it is that I continue to struggle within my own department, within my own city, to try to get that kind of commitment across the board. So I think that this is an incredibly important, but it can also be a pretty challenging industry to kind of work through and whatnot. So I'm really excited to hear. I know that our partners at Business Workforce are excited about it. So I think we're hoping to kind of be a little bit of a spectator for the moment, and then see how it's playing out and how it's being utilized. But this is great. I'm really glad. I didn't know this presentation was going to be on today, but this was really informative.
Thank you. And thanks for your comments there. It certainly is challenging, and we understand that and know that community input is really going to help guide the success of this program. And so we are going to be launching in Q1 some stakeholder engagement groups. We'll have different engagement groups for our CBO partners, government entities, MCO partners, to really help guide the direction of the program. So appreciate your comments there.
Great. Melanie.
So I have actually heard a little bit about this because I know a couple of our nonprofits and one of our main hospitals is using it. So Dignity Health, I believe, is part of it, along with Ascend. And they really have been sharing what they really appreciate about the closed loop system of it, where it really does help kind of track all the way around. My question is it an opportunity to see who is all utilizing the system? Only because we also do host the East Valley Resource Coalition, and we try to gather all our nonprofits together quarterly to kind of meet, greet each other, but we do presentations. And I thought, knowing if this might be valuable information to them to see how they may be able to participate in it and get through that, we've kind of tried to make our own little resourcing opportunity, but this sounds like a neat system. So I don't know if that's something that you could send to Kelly to tell us who's all already utilizing it, and then I can reach out individually, obviously, to see if we can set you up for a presentation.
Yeah, I would be happy to share. We have a list of orgs that are live. Of course, you know that the second we publish this, then it's outdated. So I think this was last updated at the end of November, I believe. So I can send that to you. And then if you're looking for like community specific information, I can pull that, and I would be happy to share that directly with you, Melanie. Let's see.
Any other questions for Kelly?
Madam Chair, I didn't have a question, but I have a comment. It's so interesting. I literally just got back from a presentation that they did, Unitas at the Grid in Phoenix.
Oh yeah, the
yes.
in-person one today.
Yeah, it was really good. What beautiful people. I really knew this much, very little about it, but we're all in. So I plan to take this to my leadership and discuss how this closed loop referral system is very trauma informed, and that this will just be another tool in our toolbox to make sure that folks are getting resources that meet all of their needs, are geographically located close to them so that we can reduce the barriers to them accessing them, and then for us to know really what our clients are accessing as far as referrals. So for us, it's just going to be it for us at Care 7. We are an access provider now. So this is really going to help inform our business model as we move forward. So great presentation. I'm glad I got to hear it twice.
Well, thank you. Thanks so much for those comments, and for the shout out to our Unitas partners. I really do mean, like, we all couldn't do this on our own. It's a true partnership with Access, with Solari, and with Unitas.
Yeah, very, very enlightening. So I'm happy to participate.
Thank you.
Well, thank you very much, Kelly. Appreciate it, and look forward to staying in touch and hearing how the implementation continues to go, and welcome you back anytime to provide us with those kinds of updates or data that you have, where the municipalities might be able to be responsive in gaps that you're noticing.
Thank you. Thank you so much for this opportunity, and would be happy to continue this conversation.
Great. Thank you. Moving on to item 6, the MAG region is one of the fastest growing regions in the nation. And with that growth has come a recent rise in home prices, the housing market, as well as the larger economy of the region have shifted over the past few years. Maggie Wong, research analyst extraordinaire with MAG, will present a report on an analysis of current trends in the economy, real estate transactions, and housing affordability across the region. Maggie?
Thank you so much, Madam Chair. Good afternoon, everyone. I'm Maggie. I'm a research analyst here at MAG, and I'll be walking us through some of these trends for our region. I know we're kind of on limited time, so I'm going to try and get us through as quickly as possible, but hopefully these slides will be available to you because there's a wealth of information in here. So starting off, as you heard, Maricopa County continues to be one of the top counties in terms of population growth. We added just under 57,000 people between 2021 and 2022. You can see here that most of the top 10 counties are larger Texan and Florida counties, but we lead in terms of numeric growth. We're also seeing that the unemployment rate is pretty similar to the US as of October this year. Phoenix is at a 4% unemployment rate, while the US is at 3.9%. Inflation is continuing to trend down, which is a good thing. So we can see the Phoenix MSA here in green compared to the US in gray, falling from a peak back in August of 2022, and we're now just a little lower than the US. And for this latest October update, inflation was influenced primarily by increases in pricing of medical care and shelter, and offset by drops in pricing of vehicles as well as apparel. So now looking at cost of living, there's this cost of living index that uses the pricing of goods and services across the nation. And so there's a base of 100 as the national average cost of living, and we are above that. And this is a metric where we do not want a higher ranking. So what's concerning is that 2 years ago in 2021, we were ranked 18th, but we are now ranked 12th. So we're seeing a higher cost of living compared to peer metros. Looking at employment, we are diversifying our economy. You can see here that the biggest sectors of growth include transportation, warehousing, information technology. You may notice that retail didn't make this top 10 chart. It used to be a key sector, but only grew by 5% within this time period. But this is good because it shows that we are diversifying our economy and coming out of an economic downturn from the pandemic. Job recovery is also quicker for our region than for the nation, so we are seeing good trends here. Now we'll take a look at residential completions. So this chart is showing the total single and multifamily completions by fiscal year. We can see that back in 2005, before the housing downturn, completions were around 48,000 per year. There's a significant drop in 2011, but in the latest fiscal year, we're at 36,000 residential completions. So we're back to 2007 pre-recession levels. And you can also see that multifamily units are making up a greater share, going from 14% in 2005 to 40% now. This next chart here is showing sales transactions by price bins. So from 2011 through Q3 of this year. Let's first focus on the dark blue part of the bar. That's showing sales that were under $200,000. And then the light green section shows sales that were $200,000 to $300,000. We can see that there was a huge drop in these two categories from 2011 till now, as sales prices have increased. And what we're seeing now in this year, so in that final bar there, we're seeing a change to that trend actually. You can see that sales prices might be coming down and the lower bins are adjusting a bit. So rather than that dramatic decrease we were seeing over the past decade, it's actually looking a little more stable. So that's something for us to keep an eye on. Median sale price has been fairly steady since June of 2023 and is now slightly higher than it was a year earlier. The last peak we saw in median sale price was last year in June. Median sale price was at $475,000, but as of last month, we're currently at $439,000. So we're starting to see the housing market stabilizing, the sale price is coming down and staying fairly steady. This map is showing median sale price change by zip code across the region. So from the light and the dark orange colors, we can see that there's mostly been a decrease in median sale price in the region, but there are still some areas in the green where we're seeing increases. But this kind of goes with what I was saying earlier. Overall in the region, we're seeing a stabilization of sale prices. We also have MLS data that shows us that total inventory, so the number of homes listed for sale, has dropped since a year ago. We're also seeing that average days on market has been fairly steady since June, and with November reporting an average of 58 days on market. So that's slightly lower than a year ago. Switching gears to look at apartment rent, this is a pretty similar chart to what we saw earlier with sales, but now focusing on apartment rent bins. So the dark blue here is showing apartment units with rent under 500, and that has virtually disappeared over the years. The light green shows units ranging in rent from $500 to $1,000. Similar to before, we're seeing that decreasing trend for the green and dark blue sections, but for this year, through Q2 of 2023, it's starting to stabilize. So rather than the dramatic decrease, we're seeing it start to level out. We're also seeing that newer apartments built since 2018, and these are generally more luxury apartments being built, have a 15% higher rent compared to all apartments. And this trend has held steady for the past few years, seeing a similar trend to the overall apartment rent. Multifamily rental vacancy rate has also increased in recent years. So back in 2021, there was a low of 4.9%, but we've increased to 10.2% as of Q3 of this year. And this is a good trend to see in terms of more availability in the market. Okay, so now we're going to look more closely at availability and affordability of vacant apartment units. It's going to be a set of maps, starting with this first one. This one is simple. So the green bubbles here are showing vacant apartment units across the region, and the size of the bubble shows the number of vacant units. So what we're seeing here is that there are over 22,000 units that are vacant across the region. This next map now changes the green bubbles to a red outline if the rent is greater than 40% of median renter income. So here, where rent is greater than 2,000, the bubbles are just a red outline. And you can see how it's kind of changed, and there's different parts of the region that have vacant units but are asking for rent of $2,000 or more. Another step down, this map is now showing vacant apartment units that are affordable at 30% of median renter income, which is $1,500. You can see how now a majority of the green bubbles before are now just a red outline. And you can see that, again, there are units available, the green bubbles, but it's about where they're available. And it's not all across the region, only in certain areas. This final map is showing vacant apartment units affordable under 25% of median renter income. So now the red outlines are vacant units with rent greater than $1,250. So there are less than 5,000 units across the region where rent is less than $1,250. And I'm just going to go back through this set one more time so you can see how it changes. So once again, this is all vacant apartment units. Now these are apartment units with rent less than $2,000 in the green bubbles. Now the green bubbles show apartment units that are vacant with rent less than $1,500. And these are vacant apartment units with rent less than $1,250. So it's just an interesting analysis we've been doing to look at where there are available and affordable apartment units. We also took a look at short-term rentals in the Phoenix metro area, and there has been a 17% reduction in active units. So from the chart here, you can see there was a big increase from 2021 to 2022, but that has slightly dropped in 2023. On the map here, it's showing change in the past year in short-term rentals. Green is where there have been increases, and orange shows decreases. Looking at trends in institutional buyers, these are large investors such as Redfin and Opendoor. A year ago, about 25% of sales transactions were to these institutional buyers. That has significantly dropped this year and is now at around 14%. If you look at the historical trend pre-2020, the iBuyer sales range 10 to 15%. So we're kind of back to that pre-pandemic level. One way of looking at housing affordability is this Housing Opportunity Index. So this shows the share of homes sold that are affordable at median household income. Currently, our region is at 25% of homes sold that are affordable. This is a lower share than the US, which had 37% of homes sold that were affordable. And this is an increase from last year where we hit a low of 18%, but we're still a lot lower than we were before. You can see that there was a major drop after Q2 of 2020. Back then, we were at 70% of homes sold that were affordable. And from 2018 to 2020, we were actually more affordable than the national average, but have dropped since then. You can also see from the table on the right how we compare to other peer metros in the nation. We have better affordability than regions like San Diego, but we're still trailing behind the national average and other peer metros like Houston. Cost burden is another important aspect of measuring housing affordability. In the Phoenix region, there are 256,000 severely cost burdened households. So these are households that are spending 50% or more of their income on housing. 27% of multifamily renter households, or 1 in every 4, are severely cost burdened in our region. We're also seeing monthly evictions going up, and they have now surpassed pre-pandemic levels. So back in the gray, so prior to March of 2020, it was hovering just under 6,000, but you can see in recent months how it has gone significantly up since then, especially in October, where we were almost at 8,000 eviction filings that month. Most recently in November, there was a drop to 6,600, and this is a trend that will probably continue through the holidays, just slightly lower evictions for the next few months. Now looking at residential permits, permits are going up, which is a good trend. Between the first 2 quarters of this year compared to the year before, permits are 25% higher than the first half of 2022. And the total number of permits is capping around 47,000 to 48,000 at this time. We also have information from member agencies on the development pipeline, so what's in the works and what's on the books right now. For this map, the orange shows developments that are platted, red are active, where we have a threshold of permits or completions. So currently there are a total of 275,000 housing units in the pipeline. Out of those, 178,000 are active and 106,000 units are not yet built. So the trend here has generally been positive. Comparing what we see year to date this year to 2 years ago, total units in pipeline has gone up by about 30,000 units. Platted, not started, has also gone up a little over 30,000 units as well. Unbuilt units saw a slight drop, but is fairly stable. Some of these may be larger development projects that take longer to get infrastructure. And we have a final takeaways slide here that I'll just leave here for you to review and you can look at with the full slide deck, just for the sake of time. But besides that, we do have a Housing Data Explorer. This is an interactive dashboard that includes most of the data you saw today here. And that's all I have for you today. Please let me know if you have any questions, and thank you for having me today.
Thanks, Maggie. You always give us such interesting presentations. Really appreciate you.
Thank you. I know we sped through a lot, so open to any questions.
Any questions? Oh, I see a bunch. Okay, Susan.
First, I love Maggie. Love Maggie. She's amazing. She could be talking about cereal and I
right?
would sign up
True.
for it.
So true.
So I love these presentations because I am so unfamiliar with much of this. It's not my wheelhouse, but I always walk away, thinking about things and just kind of wondering a little bit more. There was a slide that you had, I think, on slide 12, where I think it's where the average rents were, and part of me wonders if there are impacts and have been impacts, at least over the past couple of years with COVID, with the influx of federal funding and take the slide right before this one. Yeah, this one. Mm-hmm. And as you were talking about, the difference between 2020 and 2021, in that green section is, the reality is that we know that landlords were spiking their rents.
Yeah.
So this is such a difficult conversation to really get a handle on, because there's almost these what do you want to call them, inflated kinds of scenarios out there that are difficult for us to be able to kind of navigate through, and of course they always end up being in some situations. I think that there are still communities out there that think that there's still all this federal funding coming in, and so let's go ahead and keep these rents at $2,000 a month or whatever. The other thing that I thought about was just knowing how Phoenix and the Maricopa County region is growing and attracting all of these big semiconductor transformer technology companies and everything else. I live up in North Phoenix, and I-17 is starting to just fill up with all of these little, they're not little or tiny houses, but they're like, they almost seem like a 1-bedroom home And so I'm curious how those kinds of things are starting to, tip the scales. But they really tailored towards these big Taiwan semiconductor communities and everything else. So I don't know. Those are just literally random thoughts and comments, but this is just such a hard subject to understand. Where do we go? I mean, how do we design programming and incentivize the development community, the building community to embrace all economic levels. I don't know, but anyways, I did want to say that I just love your work.
Thank you so much, Susan.
Melanie?
Sorry, I lost my mouse. Thank you, Maggie, for the presentation. Actually, I just recently used this to send out to one of our task force groups who's been studying how homelessness and low income challenges. And so one of this and some of the work you guys have done before, especially being able to show them like investor owned type of things was really shocking to a lot of our groups. So all of this information is phenomenal because you do such a great job of presenting it. So it's really helpful for us to be able to share it. Just one of the questions I had though, I mean, I know Gilbert is still on track to, we are building some additional housing. We are definitely doing multifamily, but we're going to be, built out here probably in the next 8 to 10 years. I was just curious if you know how many other communities still have the ability to grow or who's already at build out. Like what is that percentage within the region, like where we really could expect how much more housing we could even get here?
Yeah, that's a really, really great question. And I don't know off the top of my head. That's something I'll definitely take back to our team because that's another aspect to this as well. That just like you're saying, looking down the line in the future, what is the capacity we even have, right?
Right.
So I love that question and I'll definitely take it back. So thank you for that.
Thank you.
Seth?
Yeah, thanks, Maggie. Great info. Great job presenting. And a couple takeaways for me was when you showed the affordable rentals, both the East and West Valley really didn't have any after the first slide. And I know there's pockets in all over the region, but just as a that's a really telling slide. So if the slides could be shared with us, I'd appreciate that. And then Maggie, in your research world, seems like 2023 is stabilizing, but almost there may be some kind of downward trend. What are you hearing with, and I know you're looking at data, but are you hearing that what's our next steps look like, right? We don't think we're falling off a cliff or anything, but it's definitely slowing down. Is there anything that you're hearing that people are sharing with you from other economists or people what to expect for our housing market here specifically?
Yeah, that's a great question. I think most of it we're kind of waiting and seeing, to be honest, because just like you said, the past 2 years were really focused on recovery from the impacts of when COVID first hit. You saw how that caused so many things to just drop or go up just in the negative direction. So we've seen a lot of that recovery now. We're seeing that stabilizing happening. And I can't exactly predict what's to come. I haven't heard too much, but I think overall we're hearing about sales prices stabilizing, and we might see the trends start to go where as they drop, we see more of a balance of slightly more affordable housing. So we'll definitely keep you posted and are happy to come back with updates when we hear them. Thanks, Seth.
Thank you.
Any other questions for Maggie?
Not a question, but I will say I have used your, what did you call it? The
Housing Data Explorer. Yes.
Yes. Very handy. So thanks for making that available. I would highly recommend everyone check that out.
Yes, and on that, we will be updating it next after Q4. So early next year, you can expect an update with even more recent data. So thanks for calling that out.
Well, Maggie, you see, we love having you come here, so please come again and again and again. You do a great job presenting information that we all know. Well, sometimes, at least for myself, I don't even know to think on my own that that would be a great way to make the case for something until you present it to me visually. So that's really helpful. Thank you.
Thank you.
So we're going to go on to item 7. Are there any requests for future agenda items? What do you want Maggie to talk about next?
I actually have a request because I just got notified of something, and I don't know if anyone else is aware of it. I'd like to learn more about it if it's an option. It's the EECBG grant. And I don't know if other people are aware of that or who's eligible, but we popped up on a list that said we have funding available of a couple $100,000, and I don't know what it is. And actually City of Surprise was on it too, on the list. And so I don't know if that's an option to get any information on, or knowing who's utilizing it, what they're utilizing it for in the region.
Madam Chair, Madam Vice Chair, we'd be more than happy to track that down. You said it's EECBG? CBBG?
Yeah, it's an
EECBG.
Yeah, it's some kind of energy and efficiency block.
Yeah. I can, am I able to put something in the chat or no?
I believe you can, and if you're not available to, if you email it to me, I can send it out to everyone.
Yeah, it says the chat's disabled.
Okay,
So I think that's to do with open meeting law. So if you could email it to me, Madam Chair, then I can send it out to everybody.
I have a link to the program guidance.
Wonderful.
Would that be helpful?
Well, I did look it up online. I'm more curious as to if anyone is using it here and what specific projects they might be pursuing utilizing those funds. I did try to look it up and get a basic understanding, but I'm just curious if it's being used here in the region.
Mm-hmm. I know you need to be able to explain how the activity advances your broader energy efficiency and conservation goals as a part of the required energy efficiency and conservation strategy.
And so so I'm also curious, what department is managing that on behalf of a municipality? Like who might be taking that on?
And I think it would depend. I don't know that everybody has an energy efficiency and conservation strategy established already that they would be able to go on to the next step.
Right.
Yeah, Madam Chair, this is Seth. I'd second Melanie's recommendation because we were on that list. We're digging into that right now, Melanie. So we'd love to look into that with you.
Yeah, Goodyear also. Well, I don't know if we're on the list, to be honest, but we were talking about it. All right, any other comments, announcements from the membership? Any good news, success stories to share?
Sorry.
Melanie?
I was going to say Gilbert just kicked off our 2024 needs assessment. So we're out trying to update from our 2019. We'll be very interested to see what kind of results we get here after knowing a lot of landscape has changed over the last couple of years. So just really interested to see, really trying to get a lot of participation if we can, and information just because we know so much has become different. So excited to kind of get that started, and we'll wrap that up, I think, by like March or April.
Chair, Melanie, who are you guys using? Who's your vendor?
It's actually Crescendo.
Crescendo?
Yep. And they actually one for the city of Chandler. So I know they've been in the Valley and they've done a variety of things, but that is who got when we put out an RFQ for it.
Okay. Yeah, we're soliciting this year for next fiscal year. So always trying to keep my eye on who's doing a good job out there.
When we compared some of the things and looked at it, they seem to do a good job to translate things into a layman's term. which was nice to get more of a explainable document. So.
Madam Chair, Seth has his hand up.
Seth,
I was just gonna say, we, with the support of city council, we're able to get through our 99 units of affordable senior housing last week. City council, so we have it's a section 202 project with our partners, Housing Authority. So 62 years and better, people can live there for affordable housing. So we're very excited about that. We're hoping that dirt starts flying in the next 3 weeks. So that's big news for us. But thought I'd share.
great. Well, Goodyear has a mental health pilot program where we cover out-of-pocket costs for our residents who are accessing mental health services. They're provided online and include evening and weekend hours, intended to remove the barrier of being able to get an appointment for our residents. And they're even able to provide EMDR and their trauma-informed provider. And then also overcome any investment reluctance to invest in your mental health that people may be experiencing. So up to 4 sessions without demonstrating financial need, up to 10 sessions if you're 80% of area median income. So far, we've had 10 residents participate in the program in the first 6 months. So that's exciting news for us. And then we also just completed our IGA with the county to pass through 2 million in ARPA funds to Dominium for a 600 unit affordable apartment complex. They're in the process of constructing around Van Buren and the 303. Anybody else have anything to add?
We go back and put on future agenda your mental health initiative. I think that's neat. I don't know, Kelly, if I'm giving you a massive headache about going back and future agenda. Doesn't have to be the next month, but whenever, Christina, you think you're ready to present, that'd be wonderful.
Thank you. I'd be happy to. Thanks.
And I'm going to piggyback on Seth, and and I'm trying to think if I sent out an email to Mary Lynn here recently, but I was curious to learn more about the Senior Housing Assistance Fund, and where those dollars are coming in. You know, who's receiving them, what are they doing with them, that kind of thing. I know that I haven't received any of that for the city of Phoenix. So it's just curious a little bit more about that.
The funds were from the legislature, the area agencies advocated with the legislature, and they gave statewide 5 million. We got in Maricopa County, we got 2.2 million of that. And we've served about 100 people so far, and half of them are for rental assistance. The other half so far has been utility assistance. And we did one person, we helped them with property tax, and another person, we did a little bit of minor repair. So
if it's possible to get information about the eligibility, flyers, anything along those lines, with many of our agencies, rental assistance drying up. We're looking for places to connect.
Yeah, they can just refer them to the 24-hour senior helpline, which is 602-264-HELP or 264-4357.
Right. Anything else? Well, the next meeting for the Human Services Technical Committee will be on Thursday, February 8th. So you'll have a whole month to settle into the new year. And we'll see you at 2 o'clock on February 8th With no further business, today's meeting is adjourned, and thank you all for being here.
Happy holidays, everyone. Thank you.